Ribavirin for chronic hepatitis A virus infection in transplant recipe. Definition: infection with hepatitis E virus (HEV) causes epidemic cure hepatitis in developed countries and spread acute hepatitis in industrialized countries. Since 2008, cases percentage infection with developed or chronic hepatitis in immunosuppressed patients has been published.
Ribavirin, brand Rebitol. Ribavirin is an antiviral used with interferon alpha for hepatitis C. Ribavirin.
Application in nursing. Keep personal use gold isolate from other healthy people. Perform concurrent disinfection with soap and water and finish with a chemical from the health service. Throw hand washing after handling patients' stool and urine.
Hi, I'm Cheryl Dale, and I'm a nurse practitioner in hepatology. Today, I'm going to talk about PEG interferon and ribavirin for the treatment of hepatitis C. You can visit our website, www.liverinfo.com, and print off a copy of our PEG interferon ribavirin pictopamphlet to follow along with this video. PEG interferon is also known as Pegasus or Pegatron. PEG interferon is taken by an injection under the skin just once a week. A nurse can teach you how to give the injections, and a friend or a family member can also help with your injections. Ribavirin is taken in a pill form twice a day. There are 4 things you need to do when taking PEG interferon and ribavirin.
Pros and cons. Pros: China has manufacturing license and vaccine capable of preventing HIV infection, although it is not yet available in other countries. Acute infection may be accompanied by few or no symptoms. Cons: it is a disease that affects all areas of this world, but its prevalence is higher in East and South Asia.
So now let's meet some patients so we can put to work what we have learned about hepatitis E diagnostics. Our first patient is Hannah. She feels sick and had to vomit at home. She's feverish and her skin has a yellowish color. Her symptoms started 1 week ago. 4 weeks ago, she came back from Mexico when she visited family. Obviously, we think about hepatitis. Let's order lab tests. In Hannah's lab report, we can see that her liver enzyme function is significantly elevated. Furthermore, her hepatitis E tests are positive. Hepatitis E RNA is also detectable. So what's your diagnosis? Hannah has no history of immunosuppression. So let's take a look back at the graphic dealing with immunocompetent patients. Her ALT is very high, which signifies serious liver damage. Anti-HEV IgM and IgG are both positive, and we could detect RNA in Hannah's stool. Based on these results, we can conclude that Hannah is most likely in the early phase after infection.
Is applied in Ecuador. Ecuador is no endemic country for hepatitis, as is the case with Peru and Brazil. However, despite the fact that the national rate is less than 8%, it is believed that there could be people suffering from hepatitis, but they have never been diagnosed for not having sought timely medical attention.
And I think it's important to first redefine hepatitis E and its risk. When hepatitis E was discovered, it was thought to be a hepatitis hepatitis A-like disease, fecally orally transmitted, present mostly in developing countries with poor sanitation systems, poor water purification systems. And indeed, epidemic outbreaks in developing countries still occur and are quite common. We see them in the setting of refugee camps. There were major outbreaks in Chad during this past year.
Conclusion: in 2016, the WHO launched a hepatitis prevention plan in Ecuador, joined the plan with the aim of complying with vaccination as prevention. The important thing is to treat these patients with Ribavirin, with which satisfactory result has been obtained. The most important side effect is anemia, which requires lowering the dose of most patients and may be the cause of the lack of response or reactivation.
Hepatitis E is RNA virus. Spread by the fecal-oral route. Incubation period 3 to 8 weeks. Common in Central and Southeast Asia, North and West Africa, and in Mexico. Causes a similar disease to hepatitis A, but carries a significant mortality, about 20% during pregnancy. In general, hepatitis E is a self-limiting viral infection followed by recovery. Prolonged viremia or fecal shedding are unusual. In acute infection, IgM antibodies to hepatitis E virus are positive. Does not usually cause chronic disease. A vaccine is currently in development, but is not yet in widespread use. Thank you for watching. For more videos, subscribe to our channel.